I would now like to introduce to you Dr. Pat Loehrer. As many of you may already know, Dr. Pat Loehrer is the current director of the Indiana University Melvin and Bren Simon Cancer Center. He has had long-standing involvement in the clinical research throughout his entire career. He has been instrumental in leadership roles at Indiana University, Hoosier Oncology Group, ECOG, and other multi-institution collaborations. The impact of his contributions to clinical drug development and to the mentoring of junior faculty and future academic leaders is truly extraordinary. Dr. Loehrer will now share his perspective as a Cancer Center Director and address the unique aspects of the Big Ten Cancer Research Consortium.
So this is the first time officially that I've stood up in a podium where they've had a thing that says big. It makes me feel really self-conscious here. I'm going to state the obvious, but clinical cancer research, and particularly investigator-initiated trials, are an endangered species. People here at this table here grew up doing clinical trials, and it was an easy thing to do in the 70s and 80s. We would come up with a great idea, pitch it to Bristol Myers, they would fly us around the world, and the careers of many people in this room were made because of these kinds of trials. As a talk that Martine Picard gave today, I don't know if anybody heard that, it was really an extraordinary piece, a story of where we are today. The cancer centers, I think, give us a great opportunity to do something that really hasn't been done before, and that's to create a partnership. Many years ago, when we started the Hoosier Oncology Group, it was the primary care doctors and the primary oncologists that never did clinical research, and we thought that was an endangered species back then. Today, if we think about our young investigators, if there's an assistant professor in the audience here, and they're now thinking about doing a clinical trial that will get them to promotion, and they're going to be doing this through the Eastern Cooperative Oncology Group, which I'm a member of, the Southwest Oncology Group. It'll probably take them 7 to 10 years to get enough rungs on the ladder to be able to be a senior person in order to do a cooperative group trial. And if you're a clinical investigator trying to make a living doing that, it's not going to work. So there's a unique opportunity. So Steve Rosen came up with the notion of having a Big Ten consortium. I think there was a lot of reasons why he came up with it, but it was a wonderful idea to do this. But I think it presented a great opportunity for all of us to work together. Several of us around here are cancer center directors, and I'm putting in our competing renewal in September. And with the new guidelines of the cancer centers, there's a big push on team science and collaboration between institutions, whereas in the past it's been much like promotion of individual work at Michigan or in Iowa or Wisconsin. But today, actually, they are acknowledging working together. And so I think this is a great opportunity for us as cancer centers to work, taking the strengths of all our institutions and building on that, recognizing that we all can't be Memorial or MD Anderson. We don't have that kind of resources. But we can take the strengths at one institution, build it with another, with the idea of really helping our junior investigators create a career in which we've all enjoyed the fruits of this. So it is, I think this is a great opportunity. I hope that this resonates with many of you. This is not about marketing. This is about making the difference. It's about getting to our own investigators and getting to our patients the opportunities of having something that they can't get in other places. And so, again, I love bringing people together, and this has warmed my heart to have all of you here. But I think it means nothing if we don't roll up our sleeves and try to make a difference. So many of the people in the room don't know each other. Tonight may be the first time you've seen them. That's great. But I do hope in the next year, the next 2 years, that there's going to be some friendships that come out of this and true collaboration. I want to thank the staff who have put this together. Noah's done an outstanding job, and I tip my hat to Paul Goldberg, who really, the timing of that article was incredibly good, wasn't it? It was terrific. So thanks for that, because I think it does give a great introduction to this group.